Okay, Guadalupe, we're here for your liposuction this morning, and what we're going to do first is we're going to stand you up and draw out the areas that we're going to do, and then we'll get you back on the bed and we'll get started, okay?
Okay.
Guadalupe, today we are going to do her abdomen, waist, and hips. She has a very nice little figure above and below. She's just a little bit socked in the midsection here, and she's had a couple children. This is a very common presentation in our clinic where someone comes in and they've had a couple children and they want to look better and they're wondering whether they need a tummy tuck. Of course, we offer the option of all of our patients to send them out for a tummy tuck if that's truly what they want, to get rid of some of the little bit of stretch marks. But with just good lipo alone, very thorough lipo, I think you'd be amazed at the amount of skin retraction and skin tightening that happens. So you can see she's a little bit flaccid down there. She's borderline of again, she could choose a tummy tuck or could choose lipo. It's going to be nice to see the end final result with her, because we do this all the time. And when we do very thorough liposuctions with micro tunneling, extremely small instrumentation, we get a pretty amazing amount of skin retraction after the procedure. So I'm going to draw out very carefully here the areas that are going to be liposuctioned. And we'll put 5 little incision points. 1, 2, 3, 4, 5. All right, we could turn to the side all the way. Very good. And when I approach the waist and the hip region, it's important to really delineate the buttocks and give a little bit more form to the buttocks. I think most women appreciate that. So we frame in the buttocks. And what I mean by framing in the buttocks is, here's the outline where the buttock should be, right across there. You can see like this, but the buttocks gets a little bit lost in the shelf of the hip. So by taking this off and forming a nice curve through here, from a side profile, they take on, turn this way a little bit, she'll have much more form to her buttocks by carving this out right through here. And she'll appreciate that later on. Okay, we're ready to go? Okay, Lupe, we're going to make just some little incisions right here. Just a little poke. Very good. This part the patients barely feel. We use just a very tiny 30 gauge needle. And then to do our incision sites, we use an extremely small 1.5 millimeter dermal punch biopsy. So we'll make several of these incision sites in any given area, which is very, very important, because to do thorough liposuction and get adequate skin retraction and adequate fat removal, it's important to hit the areas from multiple angles to create tunneling from all different angles so that we don't get the ridging and the irregularities underneath the skin. This is the part where we're putting in the anesthesia, and local anesthesia is no different than the type of anesthesia that a dentist would use, or if you had to have something injected into your skin to receive stitches. It's just a localized numbing effect of the fat and the skin in the areas that we're working. Now, the great benefit of this, of course, is that we have an awake patient, and once we get her numb, she's not going to feel anything during the suctioning part, and that will give us a much better platform to work from. We'll have some muscle tone under there. We can have her cooperate with the procedure when we start the suctioning process. These are all very big advantages to get very thorough liposuction and very accurate liposuction. So we're ready to start the suctioning on Lupe, and for suctioning it's important. I like to use very small cannulas when we do suctioning on my abdomen, so that again we create those very fine, very small tunnels to avoid any rippling or irregularities underneath the skin later on. So you can see, compared to the size of my finger, this instrument's only a little over 2 millimeters in diameter, very, very thin. And this one is just a little under 3 millimeters. So not your traditional liposuction instruments by any means, but that's all we use here. is very, very fine-tuned precision instruments when we do our suctioning. Alright, so we're done with the most of the abdomen and the other side, but this is a very important part when we approach this part on a female. This part where we need to create this natural gully, or this little dip right here, right off the hip bone between that and the belly, so they have this sexy part of their abdomen that kind of curves in a little bit. This part, some very, very deep fat that gets lost in there, but when we have them awake, they have some nice muscle tone in there that I can have them flex and really carve that out to give them that nice sculpted appearance and that really nice little waistline. Okay, Lupe, you did very well. Congratulations. Everything looks good. We got you down to a very thin level, and I can see already the skin is coming in. So you'll be swollen for a couple weeks, and we'll bring you back and we'll get the final video. But I'm excited for you. Congratulations.